everybody, Dr. Goldson, and it is a wonderful, blessed day. But if you have knee pain, it could be a bad day just trying to walk around, getting up out of the chair, and definitely trying to go upstairs. So I have Carla with me today. This is the anonymous knee. So what we're going to talk, what Carla's been dealing with is knee pain. Not even so much knee pain, I'll let you explain it, but a knee that's been actually popping in and out for the past 10 years. And after this weekend sitting in a long position, right, the knee hasn't necessarily been able to pop back into place, and it's been giving you pain, right?
Definitely.
Okay, so you've been dealing with this for 10 years?
Just about.
Never had an MRI done? Have you ever had x-rays done?
No.
Alright, so in this particular case, the first thing that comes to my mind is one of the most common injuries of the knee, which is meniscus damage. A lot of people have probably heard about meniscus, but what is a meniscus? I have an anatomical knee here. This is actually a right knee. This is how the knee sits. This is a shin bone. This is a thigh bone. A lot of people don't necessarily think about the bone on the outside of the leg called the fibula. But in this case, we're talking about meniscus damage. Meniscus is the cartilage in between the thigh bone and the shin bone, the femur and the tibia. That cushion is not as hard as bone. It's more cartilage than anything else. It's very similar to the disc in between our spine. And so, as a chiropractor and a physical therapist, we don't necessarily just treat spine, we treat a lot of various injuries. And I'm glad Carla called me. We actually been friends for years. So she told me about it yesterday and what she's been going through. And immediately I'm thinking about the meniscus. The problem that can happen with the meniscus is this. You can have a tear in between the meniscus. Because we bear weight between the thigh and the shin, the meniscus' job is to provide cushion. But because of the weight that's bearing, especially on the inside of the knee, the bone is actually a little bit larger than the outside of the knee, so it wears down faster on the pain on the inside of the knee. And just like that, Carla's having more pain on the inside of her knee, which suggests, again, meniscus damage. If you're having pain walking upstairs, possibly meniscus. If you're having stiffness, possibly meniscus. But in Carla's particular case, she couldn't necessarily push the knee backwards and just shake it free. That's because when the meniscus becomes torn, there's floating pieces that can get stuck between the knee, not allowing the knee to go straight. So here at Goldson Spine, understanding what we're dealing with a meniscus injury, the best treatment that we can see for meniscus injury without having an MRI, and we would suggest having an MRI to see how bad the tear is, but ultimately it's trying to settle down the inflammation around the knee and try to get the knee moving. So when Carla came in earlier, I'm gonna take this down. It was painful for her leg to go and just relax it, to go straight back. How's that now?
I can feel it, but it's
not as bad. Okay. We've actually used our Doctor Goldson Spine Joint Muscle Pain Cream, among some other things. But let me show you how to work this in. Relax the leg from me. With the pain cream, you don't need a lot, just need a little bit. The reason I like this and the reason it's effective for this type of injury because it has turmeric in it. And like I said, we're dealing with inflammation around that meniscus. This is as much as you need. You're gonna have, typically if you have meniscus pain or damage, it's gonna be right on the inside of the knee, and you're gonna feel a little bump there. It's best that you take the pain cream and work it into that area that's raised. It might be a little tender. We started off with a light pressure, then we started working it up. How's that feel?
It feels great.
It feels great. So the reason that we're working this down is for two parts. One, to work the pain cream inside so it's most effective, but two, just to break down scar tissue that develops around injured areas, especially that have high inflammation. So I'm working down that knot to try to get it flat. You can't go too hard, but you work it down, and it's hard to do it yourself at home because it's hard to give yourself pain.
No.
Go ahead.
Honestly?
Yeah.
I mean, this is not even fair because you didn't think of shooting this before.
I know. We've actually done a lot of treatment.
No, I'm not even lying.
Yeah.
Like, you know you couldn't have done that when you did the test with the other one.
Absolutely.
But it's actually feeling like really good right now.
Right. So when she came in, what she's saying is we've done a lot of treatment before we turned on the camera. And one of the things we did was the pain cream. But the second thing we did, and she's feeling better, but I want to show you this so you can do it at home. Get the pain cream, rub it in, then get an ice cup. Get a cup, paper cup, fill it up with ice. Tear off the top of the paper cup, and then ice massage the area. Now you can use a cold pack, but the ice massage is a lot more intense, and you only have to do it for 5 to 7 minutes, as opposed to doing it for having a cold pack on for about 15 minutes. And then you can specifically target the area that's tender, like that one. Right? And
you don't understand how great that feels.
Right.
That's not even fair. You should have shot this like 10, 15 minutes ago.
So the point is, if you're having pain, just come in, use the pain cream, use the ice massage.